Seattle General's ICU hummed like a machine with a heartbeat. Ventilators wheezed in steady rhythm. Monitor beeps created a percussion section that never stopped, never varied, never asked for mercy. The fluorescent lights above turned everyone the color of old bone, and the smell of antiseptic mixed with something darker, the copper salt scent of blood that wouldn't quite wash away no matter how many times you scrubbed. Megan O'Brien stood at the nurse's station in her third hour of a double shift, charting with the kind of precision that made her invisible. That was the goal. Stay competent. Stay quiet. Stay unremarkable. Her badge read M. the Bryan, RN in letters small enough that nobody ever read past the first initial, and her scrubs were the standard hospital blue that made her blend into the walls like camouflage designed specifically to be forgotten. 37 years old. 12 years of nursing. 3 tours she couldn't talk about. 2 Purple Hearts she kept in a shadow box on her apartment closet shelf, wrapped in tissue paper and locked behind a childhood diary she'd never finished writing. Her left shoulder hitched slightly when she reached overhead to grab a chart from the high rack, an old injury from an older life, the kind of thing that made young residents wince if they noticed, which they mostly didn't. She was just the quiet nurse with a Nebraska accent. Just the one who worked nights and doubles without complaining. Just competent enough to be useful, unmemorable enough to be harmless. The code alarm had shrieked at 0530 that morning on the medical surgical floor. A patient in room 312, post-op from a splenectomy, suddenly burning up fever at 104.2 degrees Fahrenheit, blood pressure dropping like a stone into dark water. The attending had called a rapid response. 3 residents showed up. 2 med students. A respiratory therapist who looked like he'd never seen a critical patient outside a simulation. Nobody knew what to do. Megan had been passing the room, chart in hand, on her way back to the ICU. She heard the monitors screaming. She heard the attending saying something about sepsis protocol, maybe, or was it the resident saying they should call for infectious disease, or maybe somebody had said they should wait. The voices blurred together the way they did when people were scared and trying to sound confident at the same time. She'd walked in without being asked. Her hands moved on their own. 20 years of combat medicine, 3 years of nursing school, and everything in between had left fingerprints on her muscle memory that she couldn't wash away even if she'd wanted to. She'd checked the foresight, infected, red streaking up the arm like a map of failure. She'd called for a central line kit before the attending had even finished his sentence. She'd had the patient on broad-spectrum antibiotics, vancomycin, piperacillin tazobactam, running both, before anyone had suggested it. By the time infectious disease showed up 20 minutes later, the fever was starting to break. The attending had nodded at her. That was all. Just a single downward tilt of his chin, the kind you'd give to someone who'd handed you a coffee. The residents had looked at her like she'd stepped out of the walls. She'd gone back to the ICU and charted it all in meticulous detail. Patient name. Time of intervention. Drugs administered with exact doses and times. Assessment and plan. Clinical reasoning that was so careful, so thorough, that nobody could ever say she was overstepping. Nobody could ever say she was pretending to be something she wasn't. She was just documenting what she'd observed. What she'd done. What had worked. Dr. Marcus Pierce arrived for morning rounds at 0730 sharp, his Italian loafers clicking against the linoleum like a metronome counting down to something. Everything about him was expensive and deliberate. The watch on his left wrist cost more than Megan made in 3 months. His lab coat had his name embroidered in cursive across the left side, the way kings branded their palaces. He was tall in the way that made him look down at people when he talked to them, and his eyes moved across the ICU like he was assessing inventory at a warehouse. His gaze caught hers at the nurse's station. Or rather, it caught the chart she was holding, a patient's file for Colonel James Hendricks, admitted 18 hours ago with traumatic brain injury from an IED blast at Bagram airfield. Hendricks' case was unremarkable by trauma standards. Significant traumatic brain injury. Intracranial pressure elevated but stable. On a ventilator. Unconscious. The kind of patient who might improve with time and aggressive management, or might not improve at all. The kind of patient who gave doctors something to measure themselves against, metrics and protocols and evidence-based interventions. Pierce picked up the chart from her hands before she'd finished writing. His fingers were cold. His nails were manicured. He read through her notes with the kind of focused attention he usually reserved for teaching rounds, the moments when he'd perform for the residents and med students gathered around to watch him be brilliant. Comprehensive assessment, he said, not looking at her. He was talking to the residents who'd gathered like satellites orbiting a star. Notice how the charting here captures the clinical picture without unnecessary elaboration. This is the standard we should expect. He flipped through another page. Though I would note that the recommendation for continued sedation could be more explicitly justified by citing the ABDEF bundle for delirium prevention. Details matter. Protocol adherence matters. Consistency matters. He set the chart back on the desk with the kind of precision that made it clear he was returning something contaminated to a quarantine area. He hadn't looked at Megan once. To Dr. Pierce, she was the clipboard holder, the data entry system, the servant infrastructure that made medicine possible without being medicine itself. Room for 47, he told the residents as he started walking toward Hendrick's door. 39-year-old male. Air Force Colonel. IED blast, Bagram, September 2019. Multiple surgeries. Now stable for acute rehab. Let's assess his baseline neurostatus and discuss prognosis. The residents trailed behind him like ducklings following a parent, and Megan watched them go with the kind of stillness that came from practice. From training. From learning to be invisible while being essential. She'd been trained to be invisible, actually. The Air Force had been very good at teaching people how to do crucial things while maintaining the kind of presence that nobody remembered afterward. Captain Megan O'Brien had been a combat medic with 3rd Battalion, 5th Marines, Dark Horse Company, deployed to Helmand Province in 2019 and attached to several joint task forces including operations that she wasn't cleared to discuss even now, 5 years later. She'd saved 87 lives, though she'd only count the one she was certain about. She'd lost 4. She'd been honorably discharged with medals she never wore and a psychiatric evaluation that had flagged her for potential readjustment difficulties and a recommendation that she pursue civilian employment in a structured environment with clear hierarchies. So she became a nurse. In Colorado Springs instead of anywhere near the coasts where people might recognize the name. With a borrowed last name that was her mother's maiden name, married to a first initial and a nursing license that belonged to someone the Pentagon had decided should exist. Captain Megan O'Brien, combat medic, became M. O'Brien, RN, combat nurse, someone different and the same and neither one and both. She waited exactly 90 seconds, then she followed Dr. Pierce and the residents to room for 47. Colonel James Hendricks lay motionless on the hospital bed like a sculpture of something that had once been alive. The ventilator was doing his breathing for him. His chest rose and fell in mechanical rhythm. His eyes were taped shut. His head was wrapped in surgical dressing. An ICP monitor sat on his right side, measuring the pressure inside his skull. An arterial line ran from his left wrist, feeding numbers to the monitor that tracked his blood pressure with every heartbeat. And on his left forearm, just visible where his hospital gown had slipped up during the night, was a tattoo. Megan saw it and stopped breathing. She wasn't sure if she actually stopped or if her body just forgot how. Her hands clenched. Her jaw clenched harder. Everything inside her went into a single point of focus, like a laser sight aimed at that one 6x3-inch rectangle of faded ink that read O'Brien in military stencil font, the kind you could get at any tattoo artist near an army base, the kind that meant something to whoever was wearing it and nothing to everyone else. Interesting case, Dr. Pierce was saying to the residents, unaware that he was standing next to a woman whose entire past was waking up in a hospital bed 70 miles from where it was supposed to be. Traumatic brain injury with significant intracranial pressure elevation. Multiple prior surgeries. Current status, comatose, GCS-3, unresponsive to all stimuli. The question is whether aggressive management is appropriate or whether we should be having conversations about goals of care. One of the residents raised his hand. "What's his functional prognosis, sir? Is there any chance he'll wake up?" Pierce tilted his head like he was considering whether the question was worth answering. TBI outcomes are notoriously difficult to predict. However, given the severity of his injury, the time elapsed since the initial trauma, and his current lack of any purposeful response, I would say realistic prognostication would include a significant likelihood of permanent vegetative state or, at best, minimally conscious state. His family should be prepared for that conversation. Megan's hands were shaking. Not visibly. Not yet. Just internal tremors that felt like the foundation of a building starting to crack from the inside. She'd trained herself out of shaking during combat. She'd trained herself into precision and control and the kind of steady breathing that kept your hands level when you were running toward explosions. But that training had been 5 years ago. Before civilian life. Before the quiet. Before she'd learned that the worst kind of violence was the kind that happened in clean rooms with fluorescent lights and people in expensive shoes making decisions that affected other people's lives. "Nurse," Pierce said, not looking at her. He never looked at her. "Please ensure that the family is contacted regarding goals of care consultation. I'll be documenting my assessment and recommendations in the chart." "Yes, doctor," Megan said. Her voice sounded normal. Good. She'd always been good at sounding normal. It was one of her certifications, though nobody would ever write it on a diploma. Pierce and his residents moved on to the next patient, the next assessment, the next opportunity to perform competence and authority for people who couldn't tell the difference between the real thing and a very good costume. Megan waited until the door to room 447 had closed behind them. Then she stepped into the room and closed the door again, with a kind of quiet that was like a whisper, like a prayer, like a classified operation that had just been sealed in a vault marked "Need to Know." She pulled up the sleeve of Hendricks' hospital gown. The tattoo was still there. Still real. Still impossible. O'Brien. Her name. Not the name on her nursing license or her driver's license or her apartment lease. Her name. The one that belonged to Captain Megan O'Brien, United States Air Force, who had dragged this specific man out of a burning checkpoint outside the Bagram perimeter on September 14, 2019, when their convoy was hit by an IED and everything afterward had been orders and paperwork and a new identity and instructions to never surface in any official capacity ever again. The one who had kept him alive for 2 miles through Taliban gunfire while his abdomen was bleeding out from a compound femur fracture and head trauma and she couldn't do anything but move and breathe and keep his airway clear and get him to the bird and then never, ever acknowledge that it had happened. Colonel James Hendricks. Viper 6. The call sign came back to her like a radio frequency she'd never forgotten. The man who'd written her name on his arm the morning after extraction, in some field hospital in the green zone, while she was being read her discharge papers and told to forget everything and become someone else. But that wasn't the worst part. The worst part was that he was here. In this hospital. In this building. Under the care of a man who'd just decided he wasn't worth saving. Megan pressed her hand against his shoulder for exactly 3 seconds, and her military training took over. She didn't cry. She didn't shake. She didn't allow herself to feel anything except the cold clarity that came from knowing someone's life was about to depend on whether or not she was willing to break the rules that had kept her alive for 5 years. She pulled his hospital gown back down. She stepped out of his room. She walked back to the nurse's station and continued charting like nothing had happened, like the past and the present hadn't just collided in a hospital room that smelled like antiseptic and contained 10 different doctors' opinions that Colonel James Hendricks wasn't worth the effort to save. But she was already calculating. Already planning. Already understanding that if Pierce and his consensus of medical opinion decided Hendricks wasn't a candidate for aggressive intervention, then sometime in the next 48 hours, maybe sooner, they would have a goals of care conversation with his family. And that conversation would end with comfort care protocols. And comfort care meant withdrawing support. And that meant her classified past was about to become someone's funeral. She needed to know why he was here. She needed to know what had happened since Bagram. She needed to know who would come if she called, and whether calling was even possible anymore, and whether the Pentagon had erased her far enough that they wouldn't notice if Captain Megan O'Brien suddenly started asking official questions about a man she wasn't supposed to know existed. And she needed to do all of it without flinching, without breaking, without giving anyone, especially Dr. Marcus Pierce, any reason to look at her more closely than they already didn't. The intercom crackled at 0900 sharp. Grand rounds, conference room 3. All attending physicians and senior residents. Now. Dr. Marcus Pierce's voice carried the weight of someone who'd never been told no, who'd learned long ago that repetition and volume could substitute for competence. Megan was in the ICU when the announcement sounded, updating Colonel Hendrick's fluid balance on the whiteboard mounted beside his bed. She didn't look up. She didn't need to. She already knew what was coming. By the time she finished her charting and made her way to the hallway outside the conference room, 10 doctors had assembled like chess pieces on a board that Pierce controlled. Dr. Vance, Dr. Kellerman, Dr. Shaw, Dr. Ramirez, Dr. Okonkwo, Dr. Patel, Dr. Jong, Dr. Novak, and Dr. Stein stood clustered near the glass walls, coffee cups in hand, waiting for the performance to begin. They didn't know they were about to become instruments in someone else's orchestra. The room smelled like burnt coffee and the particular silence of people about to witness a public crucifixion. Megan stood just outside the door, her badge clipped to her scrubs, her posture the perfect picture of professional routine. She could see Pierce through the glass, standing at the head of the table like a conductor preparing to begin a symphony. In his hands, he held her charting, 3 weeks of her patient assessments, her documentation, her meticulous attention to detail. He held it the way someone holds contaminated evidence. This, Pierce announced, his voice carrying effortlessly through the open doorway and down the hallway, is what happens when we lower hiring standards. When we prioritize filling positions over maintaining the rigorous documentation practices that keep our patients safe. He held up a single page, turning it like a museum curator displaying a forgery. Substandard documentation practices that endanger patient outcomes. Notice here, incomplete assessments. And here, creative interpretations of protocol that I'm being generous calling protocol violations. Megan's jaw tightened. Just enough that someone looking very carefully might have seen it. She didn't move. Her hand stayed perfectly still at her sides, folded loosely in front of her hips the way her instructors at Lachlan had taught her 15 years ago, a position that looked relaxed but was actually the fastest stance to move from if something required moving from. Pierce continued, his voice dropping to that conspiratorial tone that made his lies sound like intimate truths. Medication times that don't align with charting. Assessment gaps that suggest she's documenting after the fact rather than in real time. The kind of careless shortcuts that, frankly, create liability for this institution. He let that word hang in the air. Liability. Every hospital administrator in the state heard that word the way hearing-impaired people heard train horns, as a serious warning that couldn't be ignored. The 10 doctors nodded in practiced unison. Dr. Vance made a note. Dr. Kellerman's face arranged itself into an expression of professional disappointment, the kind you wore when someone you'd had high hopes for had let you down. None of them looked up from the page Pierce was holding. None of them looked at the hallway where Megan stood, watching her professional reputation being assembled into a fictional scandal with the precision of a surgeon making an incision. Every single error Pierce detailed was a fabrication. Medication times she'd recorded were documented in 2 separate systems. Assessment gaps he referenced existed only in his interpretation of what he wanted her to have written. Protocol violations he cited required breaking actual hospital policy to commit. But the 10 doctors didn't know that. They knew only what Dr. Marcus Pierce, senior attending physician with 15 years at Seattle General and a reputation as a meticulous clinician, was telling them right now. Megan's eyes locked onto his through the glass. Not with anger. Not with humiliation. With the flat, cold stare of someone who'd seen much worse than this and lived to walk away from it. The kind of stare that made the air around her seem to cool by several degrees. The kind of stare that came from understanding, on a cellular level, exactly what was happening and exactly why it wouldn't work. When Pierce finished his monologue, when the 10 doctors had been properly primed to view her as a liability rather than a colleague, when he'd laid the groundwork for whatever came next, Megan took one step forward. Just one. That was all it took. Funny, she said, her voice carrying no particular emotion, no tremor, no indication that the last 10 minutes had registered as anything more significant than a minor inconvenience. How my substandard work saved 3 coding patients this month while you were billing consults you never performed. The silence that followed was the kind that happens when someone says the thing everyone else was thinking but no one had the nerve to voice. The fluorescent lights above her head seemed to hum louder, as if the hospital itself was holding its breath. Pierce's face flushed. His mouth opened and closed like something mechanical that had suddenly lost power. But Megan was already moving, turning with the fluid economy of motion that came from muscle memory older than her career as a nurse. Her footsteps echoed down the corridor like gunshots, each one precise, measured, deliberate. The sound of someone walking away from something not because they were running, but because they'd already decided there was nothing behind them worth remaining for. She didn't run. She didn't hurry. She walked like someone who'd made a choice and was comfortable living with the consequences. At 11:30, the retaliation began in earnest. The vending machine on the 3rd floor was the unofficial gathering place for residents between rotations, a place where the hierarchy loosened just enough for people to talk openly without attending physicians watching their faces. Dr. Shaw and Dr. Ramirez had claimed a corner near the machine when Megan came to get her coffee, and they didn't bother lowering their voices. They'd been given permission, whether explicit or implicit, to speak freely, and permission was all some people needed. "Oh gosh, doctor, maybe we should actually check on our patients instead of just billing for consults we never performed," Dr. Shaw said, his Nebraska accent so exaggerated it bordered on performance art. He drew out the vowels like he was pulling taffy. "I'm just a simple farm girl who doesn't understand how real doctors practice medicine." Dr. Ramirez laughed, the kind of laugh that required an audience to validate it. Megan could see Dr. Pierce in his office 3 rooms over, visible through the floor-to-ceiling windows that made privacy in hospitals an illusion. He was watching them mock her. Nodding. Phone in his other hand, already making calls, already moving pieces on the board. Megan filled her coffee cup without acknowledging either resident. Her knuckles were white around the paper cup, not from fear, but from the particular effort it took to remain stationary when everything in her training suggested movement. Her hands had been trained to act. Standing still required a different kind of discipline entirely. She walked back to the ICU with the cup held at exactly the right temperature, her posture unchanged, her face showing nothing but the professional neutrality of someone clocking in for another shift. But the nickname had started circulating now. Farm girl. It would stick to her like blood on a uniform, following her through every hallway, every break room, every moment when she wasn't directly supervising her own reputation. By 1400, the hospital had weaponized its own infrastructure against her. A security guard named Martinez stood outside the nurses' lounge with orders that he delivered with obvious discomfort. "If you need to access restricted medication records, Nurse O'Brien, I'm instructed to escort you out immediately." He didn't like it. You could see that in the way he wouldn't quite make eye contact, in the careful neutrality of his phrasing. But he'd been given an order, and orders were orders, and this particular order had come from Dr. Pierce through the hospital administrator's office, which meant it carried the weight of institutional authority. Megan passed him without acknowledgement, moving into the break room like he wasn't there. She poured another cup of coffee, this one black, no sugar, the way Captain Megan O'Brien had learned to drink it during her second deployment to Helmand Province. The coffee here was terrible, burnt, old, tasting like it had been made sometime during the previous shift and left to oxidize into something closer to tar than caffeine. She drank it anyway. Her phone buzzed. A text from the shift supervisor, the one Pierce had handpicked 6 months ago after the previous supervisor had transferred to a different hospital chain. The text was professional, apologetic, but unmistakably clear, effective immediately. She was being reassigned to the pediatric wing. Performance concerns under review. Megan read the message twice, then set her phone face down on the table. Her jaw didn't clench. Her breathing didn't change. She simply processed the information the way she processed any incoming intelligence, as data that required analysis, not emotion. The pediatric wing meant she would be separated from Colonel Hendricks. That was the point. Separated from his chart. Separated from the ability to advocate for him. Separated from the knowledge that something was wrong with his care and no one was going to do anything about it because the person who could see the problem was being systematically removed from the equation. She understood now. The grand rounds performance. The orchestrated mockery. The security guard stationed outside the lounge. This wasn't just about humiliation. This was about control. This was about making sure that whatever Dr. Marcus Pierce wanted to happen next, Megan O'Brien would be positioned somewhere she couldn't prevent it. The coffee was terrible. She drank it anyway, sitting alone in the break room while Martinez stood outside like a sentinel guarding against her own competence. And somewhere on the third floor, in a room with a hospital bed and machines that tracked every heartbeat, Colonel James Hendricks slept, unaware that the woman who'd saved his life on a dusty airfield 5 years ago had just been checkmate from the board. The break room smelled like burnt coffee and someone's abandoned lunch from 2 shifts ago. Megan sat alone at the chipped Formica table, Colonel Hendricks' chart spread flat before her hands, her finger tracing the admission notes with the precision of someone reading a letter written in code. Bagram Airfield. The notation sat there in clinical black ink like a secret the hospital didn't know it was holding. 5 years. 60 months. 1,825 days since she dragged him 2 miles through Taliban gunfire with his left arm shattered and his skull bleeding into the dust of a runway that smelled like jet fuel and terror. She didn't remember pulling her hand back from the page. The chart was in her lap now, and Martinez was watching her from the doorway with the expression of a man who'd been ordered to watch everything she did. "You're not assigned to that unit anymore," he said quietly. Not unkind. Just factual, like reading a weather report. She closed the folder without looking at him. The movement was smooth. Controlled. The trembling wasn't visible, though it lived in her chest like a trapped bird. "I know. The thing about being a combat medic was that you learned to compartmentalize pain into categories: immediate threat, manageable, and acceptable loss." Hendricks fell into the third category now, which meant she could think about him without her hands shaking. Could read his name in a chart without her voice cracking. Could walk past his room, soon, when she was reassigned, without stopping. This was a skill they'd taught her at Lackland. Not in any official curriculum, but in the spaces between the official curriculum, in the eyes of the instructors who'd seen soldiers survive things that should have killed them and had to pretend they were fine. The ER was chaos at 1900 hours. Megan could hear it from the pediatric wing where she'd been exiled that afternoon, reassigned effective immediately per Pierce's orders, a strategic move so clean it barely qualified as cruelty. It was just paperwork. Just a staffing adjustment. The pediatric patients were stable, and her expertise was better used elsewhere, and certainly she understood that sometimes priorities shifted based on operational need. That was the language. Operational need. As if she didn't understand that every word was designed to separate her from Hendricks' case before something happened. Before she could help. Before she could be positioned to save him and therefore be positioned to question why he'd been written off. The monitors in the pediatric unit beat their steady rhythm while she checked vitals on a 7-year-old recovering from appendicitis and tried not to listen to the ER commotion below. At 2000, Dr. Vance arrived. She heard his voice in the hallway, authoritative, dismissive. Then Dr. Kellerman. Then Dr. Shaw, whose specialty was trauma but whose presence in Hendricks' room lasted exactly 4 minutes before she heard his footsteps retreating. The rotation was happening. She could feel it like pressure building in a sealed chamber. 10 doctors had been scheduled to rotate through the ER that night. She knew this because she'd read the staffing board that morning before her reassignment was official, before the world had reorganized itself into compartments where she couldn't access information about a man whose heartbeat she'd felt against her palms when it had stopped beating. By 21:30, Megan had transferred the stable pediatric patients to the night nurse and was sitting in the staff restroom that nobody used, the one on the 4th floor with the broken vending machine and the fluorescent light that buzzed like it was dying. She wasn't thinking about Hendricks. That was the operative phrase, wasn't thinking. It was a skill. You could be aware of something without thinking about it. You could know he was 4 floors down in a hospital bed with his chest rising and falling on its own power. You could know the machines monitoring him were displaying numbers that meant something specific, and you could not think about any of it. Not yet. At 21:47, Dr. Ramirez walked past the break room where Megan had moved, and she heard his phone voice, the one doctors used when they were calling families. Mrs. Hendricks. Yes, your husband is stable, but we're recommending comfort care at this time. The words arrived like rounds, each one a small explosion of impact. Comfort care. The phrase that meant no intervention. No heroics. No desperate measures. Just pain management and the slow accumulation of hours until the body gave up on itself. Megan didn't move. She'd been trained by people who made her look undisciplined, trained by sergeants who could watch their own team get hit and keep their vocal tone steady. This was nothing. A doctor recommending comfort care for a patient. This happened thousands of times per day across thousands of hospitals. It was medicine. It was reasonable. It was correct for a patient whose 10 attending physicians had documented consensus that intervention would be futile. 10 doctors. The number sat in her mind like a physical object. 10 separate people had examined Hendricks and refused to help him. Dr. Okonkwo came next, then Dr. Patel, and the pattern was becoming clear like a photograph developing in chemical baths. Megan had been removed from access precisely when she needed to be removed, when there was work to do that she shouldn't be allowed to do. Pierce had orchestrated this with the precision of someone who understood institutional power the way Megan understood hemorrhage control. He'd identified his threat, a nurse with unexplained competence, a woman with steady hands and no traceable background, an anomaly in the system, and he'd begun removing her agency 1 bureaucratic inch at a time. The reassignment wasn't punishment. It was preventive architecture. Remove her from the unit, establish medical consensus among 10 rotating physicians, create a paper trail documenting that intervention had been considered and rejected by multiple independent observers, and then when the patient deteriorated, when, not if, there would be no ambiguity about what should have happened. Nothing would be her responsibility because she wouldn't have been there. By 2200, Dr. Jong had rotated through, his examination lasting 3 minutes. The pattern held. Each doctor arrived, examined Hendricks, looked at Pierce's orchestrated chart entries documenting the consensus opinion, and departed. Each one documented their own refusal to intervene. The chart was becoming a museum of abandonment, each entry a brick in a wall that couldn't be breached. Megan could picture it clearly, every notation, every signature. She'd read enough charts to visualize them with perfect recall, a skill that had saved lives in the ER and was now saving nothing because she wasn't in the ER anymore. At 22:45, Dr. Novak and Dr. Stein completed the rotation. 10 doctors. That was the consensus. That was the weight pressing down on Colonel Hendricks from the institutional equivalent of £1,000 per square inch. It wasn't that any of them were wrong individually. It was that together they formed something unassailable, something that couldn't be questioned because questioning would mean questioning all of them, and you couldn't call 10 separate physicians incompetent without starting a war that would destroy everyone involved. Megan sat very still in the break room with the burnt coffee smell and Martinez standing guard in the hallway. She wasn't thinking about Hendricks. She wasn't thinking about the fact that Pierce had just spent the entire evening building a structure of medical consensus specifically designed to prevent her from doing the only thing she was ever actually good at. She wasn't thinking about the phrase comfort care and what it meant to a man who'd survived Bagram, who'd survived Taliban gunfire and blood loss and the particular terror of knowing that the person next to you is gone and you're still breathing. The monitors on pediatrics continued their steady beeping, 4 floors above her. The night staff settled into their rhythms. The hospital moved through its cycles like a living thing, unconscious of its own processes, and somewhere in that vast machinery, a door was quietly closing on something that the system had already decided wasn't worth saving. That was when the code alarm shrieked. The code alarm shrieked at 0200 hours like something with teeth. Colonel James Hendricks' chest became asymmetrical in one terrible moment, his trachea deviating right, his left lung collapsing as pressure built inside his thoracic cavity like a time bomb counting down. Oxygen saturation dropped from 88 to 76 to 64 in the span of 4 heartbeats. The monitor screened its digital warning. Tension pneumothorax. Untreated, it would kill him in minutes. Megan heard the alarm from pediatrics on the 4th floor, where she'd been reassigned to chart on children with ear infections and seasonal asthma. She was standing at the medication dispenser when the sound cut through the hospital's background hum like a knife through cloth. Her hand stopped moving. Her head tilted. The clinical part of her brain, the part trained in Kandahar, honed through 3 tours, sharpened by the weight of decisions made under fire, registered location, ICU. Time middle of night. Urgency, maximum. The institutional part of her brain remembered Dr. Pierce's explicit order. The security escort stationed outside the restricted medication locker. The folder of fabricated incident reports being compiled in real time by hospital administration. She moved anyway. Her feet knew the way. Her legs moved like muscle memory taking over, which it was, muscle memory that ran deeper than policy, deeper than fear of termination, older than the uniform she no longer wore but would never stop being. The stairwell doors opened without her seeming to touch them. Her scrubs barely made sound on the tile. Down for flights, across the Skyway Bridge, into the ICU corridors where the real work happened, where 10 doctors had already decided that Colonel Hendricks wasn't worth saving. The crash cart was where it always was, outside the trauma bays, its drawers organized by someone who understood that precision under pressure meant the difference between walking and dying. Megan's hand went directly to the 14-gauge needle without hesitation, without the tremor that might have been expected from someone whose career was in ruins, whose file was being salted with lies, whose entire identity had been erased by federal order 5 years ago. Her hands didn't shake. They never had, not since Bagram, not since she'd learned to start fours during mortar fire with shrapnel singing past her ears and the taste of copper and fear in her mouth. The ICU room was chaos-contained, controlled, professional chaos, but chaos nonetheless. The ventilator hissed its mechanical rhythm. The heart monitor displayed a rhythm that was deteriorating by the second. Hendricks' skin had turned the color of old paper. Dr. Novak was calling for a chest tube tray, which was already too late, which everyone in the room knew was already too late. Megan moved past them without greeting, without explanation, with the kind of certainty that comes from knowing exactly what needs to happen and being the only person in the room qualified to make it happen. She positioned the needle at the second intercostal space, mid-clavicular line, the anatomical landmark burned into her muscle memory from field medicine courses and 600 live procedures across 2 continents. Her left hand found the landmarks, second rib, palpate below it, mark the space between. Her right hand held the needle with the steadiness of someone who had performed this exact procedure at 0300 in the dark while enemy fire chewed up the walls of a field hospital in Loga province. She pushed through skin, through muscle, through the pleura. The rush of pressurized air came like a confession. That hiss, it was the sound of something trapped escaping, of pressure that had been building with nowhere to go suddenly finding relief. It was the sound of a diagnosis confirmed, of a life saved in a single moment, of Megan O'Brien stepping across a line she couldn't uncross. Hendricks' oxygen saturation began climbing immediately. 68, 74, 82, 92. His chest expanded symmetrically. Color returned to his face like someone turning a dial toward living. His heart rate stabilized. The mechanical chaos became organized rhythm again. Dr. Novak exhaled in relief, a sound like permission, like vindication, like he'd just watched a colleague do what 10 other doctors had collectively refused to do. Dr. Pierce's face turned a shade of crimson that didn't match the hospital's neutral palette. He emerged from where he'd been standing in the corner. Had he been there the whole time, watching? The thought flickered through Megan's mind and was immediately dismissed. Focus was precision. Emotion was distraction. That was another rule from Bagram. You just assaulted a patient against direct medical orders, Pierce said, his voice shaking in a way that sounded almost like fear. Almost like someone watching their power structure collapse in real time. Security. Remove her. Now. Megan stepped back from the crash cart with the same calm that had kept her alive through 3 tours in the war's worst places. She set the used needle on the sterile field. She didn't look at Pierce. She didn't acknowledge the security guard who appeared in the doorway with the confused expression of someone who'd been called to escort a nurse away from the ICU during an active medical crisis. She looked at Colonel Hendricks, still unconscious, still breathing, still alive, and registered the faded tattoo on his left forearm of O'Brien in military stencil font, the call sign she'd earned in blood 5 years ago. He wouldn't remember her. The traumatic brain injury from the Bagram IED blast had stolen all memory of the medic who'd dragged him 2 miles through Taliban gunfire. But his arm remembered. Bodies remember what minds forget. By 03:15, the hospital board president had arrived. Gerald Whitmore, golf partner of Pierce, appeared at the main entrance in khakis despite the hour. His car was still running in the circular drive. This wasn't a normal termination proceeding. This was execution. By 0400, 2 state medical investigators flanked the administrator's office, their briefcases full of paperwork. They reviewed a personnel file that Pierce had been salting with forged incident reports for 3 months. Medication errors Megan never made. Patient complaints that were never filed. Safety violations witnessed by staff members who didn't exist. Fabrications built on top of fabrications, a structure of lies so solid that institutional inertia would push it forward like a boulder down a mountainside. Exhibit A in her termination hearing. At 0600, Megan stood at a rain-soaked bus stop outside Seattle General. Colorado Springs was cold at dawn. The kind of cold that seemed to come from somewhere deeper than weather, from the place where decisions are final and futures are erased. She clutched a cardboard box containing the fragments of 9 years. A cracked World's Best Nurse mug that a pediatric patient had given her before he was discharged. A dying succulent with brown-edged leaves that she'd kept alive through 3 reassignments. A photograph of her fire team from Bagram, half their faces crossed out with black marker, not because they were forgotten, but because they weren't coming home. Rain soaked through her scrubs. A bus passed without stopping. Another pulled up, doors sighing open. She didn't move. She'd been ordered to disappear after the Bagram exfiltration went sideways. A classified operation so buried that the Pentagon had erased her service records entirely. Captain Megan O'Brien became Megan O'Brien, civilian nurse, ghost. Official records reflected no military service. No medals. No rank. No name that could be connected to anything the government had already decided should never have happened. She'd signed papers acknowledging that discussing her service would result in federal prosecution. She'd chosen the hospital because it was far from the coasts, far from military bases, far from anywhere that might trigger coincidences. She'd chosen the ICU because that was where her skills meant something. That was where she could still save people, even if nobody would ever know what it cost. Now she wasn't even that. The rain fell harder. 52 degrees and dropping. The box was getting wet. Somewhere inside the building, Colonel Hendricks was breathing because her hands had moved without hesitation. Somewhere inside the administrative offices, Dr. Pierce was already crafting his narrative, a rogue nurse acting outside her authority, a patient she was never cleared to treat, a violation of protocol that he documented with perfect clarity and absolute dishonesty. The doors of the next bus hissed open. Megan O'Brien, dismissed from service twice, stepped aboard with the remainder of her life in a cardboard box. What she didn't know yet was that someone had been watching. At 0600 the rain fell like bullets on the parking lot. Megan O'Brien stood at the bus stop with a cardboard box balanced against her hip, the kind of box that held the remainders of 18 years compressed into 3 dimensions. Inside, a cracked ceramic mug that read World's Best Nurse in faded letters, a dying succulent with brown edges, its soil damp and heavy, and a photograph bent at the corners. The photo showed 5 people in desert sand, faces sun-darkened and grinning, weapons held low, the kind of moment that exists for exactly 1 second before everything changes. Half the faces had been marked through with black marker in deliberate strokes. Rachel Chen. Corporal Mitchell Graves. Sergeant Torres. The faces that didn't come home were the ones blacked out, a visual record of absence. The bus pulled up. She didn't board. Her phone had buzzed once, then twice, then 3 times in succession. She'd ignored it the first 2 times. The third time she looked. Kyle's mother. Calling from Seattle General. "You need to get back here," his mother had said. "The hospital's lawyers want you present for something. They said it involves Colonel Hendricks and your termination. They said it's urgent." She'd hung up the phone knowing she couldn't go back. Once you're erased by the Pentagon, you stay erased. Going back to Seattle General meant being recognized, documented, filed away in the system. Orders were orders, and her orders were to disappear. But Kyle's mother had used a particular phrase, your termination. Not your case. Not your hearing. Your termination. As if it had already happened and everyone was waiting for her to acknowledge it. The bus driver looked at her. She turned away from the bus stop and began walking toward the nearest intersection where taxis circled. 32 minutes later she pushed through the emergency department doors at Seattle General. The place felt different when you knew you weren't coming back. The fluorescent lights buzzed like insects trapped in plastic, the air tasted like antiseptic and burnt coffee, and every face that passed her moved with the quality of people doing jobs they were trained to do. She had done this job. These hallways had been her territory. Now they belonged to someone else. The neurology wing was on the 4th floor. She took the stairs instead of the elevator because elevators meant cameras and she needed to move like a ghost. At the landing between floors, her breath came steady and controlled, no tremor, no hesitation. Pain is information. Absence is information. Fear is just adrenaline running through channels that have done this before. Room for 47. Colonel James Hendricks lay in the hospital bed with his eyes closed. His left arm rested on top of the blanket and on his forearm, visible in the morning light, was the faded tattoo in military stencil font. O'Brien. Her last name. Her identity, written on a man's skin 5 years after the night she dragged him 2 miles through Taliban gunfire while his blood soaked into her uniform and her mind had laser-focused on a single question, how fast can I move? He opened his eyes. For 3 full seconds neither of them moved. Then his mouth opened and 2 words came out, the kind of words that only made sense to 2 people who had been in the same place when the worst happened. Viper 6. That was her call sign. That was her identity. That was the name they'd screamed into radios while fire rained down on the extraction point. Viper 6, status report. Viper 6, respond. Viper 6, where are you? Viper 6, the name she'd buried so deep she'd almost convinced herself it had belonged to someone else. Tears rolled down the colonel's face, moving like they had purpose, like they were carrying something he couldn't say. His hand trembled. His entire body trembled. She reached forward and placed her hand on his shoulder and he gripped her wrist with the strength of a man who had been told he was too damaged to be saved and had just discovered that he had been wrong. You remember, she said. Not a question. My body remembers, he whispered. My brain's still broken but my body knows. I know that voice. I know those hands. You carried me. You carried me out. At 1400 the hospital conference room filled with board members and hospital lawyers. Megan sat in the back corner with her cardboard box at her feet. Kyle burst through the double doors like his body had made a decision his brain was still catching up to. His backpack was unzipped, dangling off one shoulder, and spilling from it came a shadow box with museum-quality mounting. The box tumbled across the polished conference table and scattered to a stop in front of the hospital board president. Inside the shadow box, 3 medals caught the light. Bronze Star. Purple Heart. Combat Medical Badge. Mom, Kyle said, his voice cracking between the words like his body was about to betray his resolve, they need to see these. You earned them. Colonel Hendricks rolled his wheelchair to the door frame. The man who had been unconscious was now awake and aware and certain. He looked directly at Megan and whispered the words again. Viper 6. That was when the back door opened. A 3-star general in dress uniform walked into the room like he had every right to be there, which he did, which everyone would recognize the moment they saw the stars on his shoulders. His presence made the air pressure change. He moved to the conference table and lifted the shadow box with both hands, the way you handle something that matters more than your own life. The fluorescent lights gleamed off the medals as he opened the folder in his other hand. Captain Megan O'Brien, the general said, his voice pitched to carry, United States Air Force, Special Operations Command. Citation reads as follows. He paused. Every person in the room stopped breathing. For extraordinary heroism under enemy fire evacuating 12 wounded personnel from Bagram airfield under sustained Taliban assault, demonstrating exceptional courage and medical competence in direct defense of United States military personnel. Dr. Pierce stood up. His chair toppled backward and clattered against the wall, the sound loud enough that everyone flinched except Megan. He slammed both hands on the table. This is fabricated nonsense from a disgraced employee. His voice had gone thin, panicked, the sound of a man watching his world transform in real time. These documents are forged. This woman is a liar, Anna. The side door opened. 2 FBI agents entered with the kind of coordinated precision that meant they had rehearsed this exact moment. One of them moved directly to Dr. Pierce. The other stood in the doorway, establishing the fact that nobody was leaving. Dr. Marcus Pierce, the first agent said, "You're under arrest for violations of federal law, falsifying government documents, attempting to alter classified military service records, and conspiracy to obstruct federal investigations." The handcuffs clicked. Pierce's face cycled through four emotions in 6 seconds: denial, rage, fear, calculation. The calculation lasted the longest. For just a moment he was calculating odds, exits, stories he could tell. Then he realized there were no stories left. "This is absurd," he said. His voice had changed. It sounded smaller. I only made a few inquiries into her background, standard employment verification." The lead agent held up a printed email. His hand was steady. Everything about federal agents was steady. 3 weeks ago you contacted the Department of Defense Personnel Center claiming to be Captain O'Brien's attorney, requesting full service records for a medical malpractice case. When initially denied, you submitted forged court documents and a fabricated FOIA request. These actions triggered automatic Pentagon security alerts for attempts to access classified special operations personnel files. Pierce's Italian loafer stumbled as they walked him toward the door. He tried to maintain his posture, tried to preserve some shred of dignity, but his shoes betrayed him, skidding on the polished floor like he was losing traction on his own gravity. Every phone camera in that room captured the perp walk. The silver handcuffs. The wrinkled designer shirt. The face of a man watching 18 years of careful construction collapse in 45 seconds. They walked him past the nursing station on the way out. A nurse looked up from her charting. Another nurse stopped moving. A third nurse simply stared at the man being escorted out in handcuffs, the man who had orchestrated Grand Round's humiliation, orchestrated the consensus of 10 doctors to refuse treatment, orchestrated her termination with the kind of institutional precision that seemed unassailable until it wasn't. The second FBI agent turned to the frozen board members. "Captain O'Brien's service records are sealed under Special Access Program protocols. Any attempt to access, alter, or distribute information about her operations constitutes a federal felony." Dr. Pierce's actions, combined with his other documented activities, have triggered a full federal investigation into his conduct. They opened a second folder. Inside, evidence of kickbacks from MedSupply consolidated. Inflated billing for consults never performed. Patient care decisions shaped by financial incentives rather than medical necessity. The board president's face went the color of old hospital linoleum as he realized that his Thursday golf partner was the least of his problems. The 10 doctors who'd signed off on Pierce's consensus opinion to withhold treatment from Colonel Hendricks, they'd all received consulting fees from the same medical supply company. All of them. The architecture of institutional abandonment had been built on financial incentives, and now the entire structure was being examined under federal light. The silence in the room was so complete you could hear the rain hammering the windows outside. Megan picked up her cardboard box and walked out. Nobody stopped her. Colonel Hendricks watched her go, his memory still fractured, his purpose still reforming, but his body knowing things his mind couldn't quite access. She did not look back. That's not how you walk away from the past. You walk away from the past the same way you move through Taliban gunfire, with your eyes forward and your breathing steady and your hands ready for whatever comes next. Kyle caught up to her in the hallway. His backpack was zipped now, the medals safely contained. He didn't ask her any questions. He just walked beside her, and that was enough. That was everything. That was a teenager deciding that some secrets were too heavy for one person to carry alone. 6 months later, Captain Megan O'Brien stood in her new office at Peterson Space Force Base in Colorado Springs, the captain's bars on her shoulders no longer a secret that could get her killed. The Pentagon had buried her after Bagram because sometimes missions go sideways in ways that congressional committees can't know about, because classified means invisible, because some people you save aren't the people the official reports acknowledge. But Kyle had decided the truth mattered more than orders. On her desk, the folded American flag from Sergeant Rachel Chen, the weight she'd carried alone until someone decided it was time to share it. The weight was still heavy, but now she didn't have to carry it by herself. That was what Colonel Hendricks had learned too. That's what everyone learns eventually. The quietest person in the room might be holding it all together. Through her window she watched Dr. Pierce climb into a medical supply van in a prison parking lot, his new job, the only healthcare work he'd ever do again. His medical license was permanently revoked. His career was a skeleton key that no longer opened any doors. Thank you for watching. If this story resonated with you, please subscribe so you don't miss the next one. Like this video and comment, have you ever been underestimated by someone who didn't know your true value? What would you have done in Megan's position? The algorithm loves engagement, and your comment helps this story reach people who need to hear it.